3, 2, 1. All right, let's see if we can get this right the first time. This is a class 702, Applied Sports Science, and this is just a research presentation covering a final paper. So the topic that I'm going to do has to deal with nuances in the literature. And as you can see right there, it just says, is massage a viable option for reducing post-exercise and delayed onset muscle soreness? Actually called DOMS for short. So I'm just going to try and cover the topic and some of the issues that are inside of the literature that are a little bit more confusing. I'll go to the next one. How do we click over there? There we go, got the slide presentation. Okay, so some of my objectives today. One is going to be the introduction of DOMS. Then after I'm talking about DOMS, we're going to just define what sports massage is. Sports massage typically is defined in a number of different ways, so I just want to give a definition that was used inside of research. There are a number of limitations in the literature, so we're going to cover, I want to say just two of the primary research articles that have limiting factors that need to be discussed in this topic. There are a number more on the physiological side, but this one is not going to cover that. It's also not going to cover the nutritional components that also affect or assist in DOMS, and sometimes nutritional issues do have an effect, but this topic is not going to cover that. I'm also going to identify the needs for future research in relation to the effects of massage on DOMS. The future research is one of the areas that I plan on addressing, so I'm going to touch on, I want to say 4 or 5 different ones. Not to go off on a tangent on oxidative stress markers and stuff like that. So again, this topic won't cover the oxidative stress markers or the somatosensory responses that need to be addressed in the research, but it is going to touch on that. And then we're going to see if massage is recommended for DOMS. So as you know, a number of athletes experience DOMS from the collegiate setting to the professional world, as well as professional bodybuilders and professional triathletes. So one of the things we're going to address is it's a broad spectrum of athletes that experience DOMS. So delayed onset muscle soreness is not just for the bodybuilding world or the fitness enthusiasts. A different group of athletes will experience it, so that's why I'm going to cover it in a broader sense. So sports massage is utilized through events, sporting events, as well as a number of professional realms and collegiate settings. However, sports massage is typically one of those things that people are not accustomed to still, even though they're used in those settings. So without a universally accepted definition of sports massage, we're going to just title it as manual manipulation of muscles and soft tissue by a qualified professional. So it also has a purpose of improving performance and recovery, which those topics in itself, performance and recovery, are diverse. So the limitations in the literature, for instance, have to do with the numerous studies on the effects of massage. A number of them don't detail specifically the type of treatment for massage, as well as the effects of the massage by the provider. So meaning, are they an experienced provider to a non-experienced provider? What type of techniques does that provider actually is accustomed to? And despite its purported benefits and frequent use, it's still confusing on the efficacy of it. So it's limited in that sense. And that means, are we able to repeat that same type of treatment to get that same effect? So even though DOMS is still a predictable condition, there's still an issue with individuals experiencing DOMS from eccentric exercises. And I wonder if I can move this. I'll try to move that camera up. Hopefully the camera's not in the bottom corner, that's why I'm trying to move that. There's no trying to do it. Okay, so one of the things with endocrine responses and some of the research by Arroyo Morales, they investigate the effects of massage on endocrine response. They measure salivary cortisol, which is another easy indicator to analyze during the time frame. Immunoglobulin A is also another one, which also has inflammatory and anti-inflammatory markers. So there's a contraindication with measuring immunoglobulin A, but they measure a number of these immunoglobulin type responses, as well as endocrine responses from like neuroendocrine responses that give us another valid indication of what's occurring pre and post. And they usually do a pre-post type of study with these. There are a number of double-blind studies and single-blind studies that perform. It's just hard to blind a massage treatment. The other indication is total proteins. So I'm going to go a little bit more into what this study identified, because this was a randomized single-blind controlled study. Some of the nuances with this literature that I reviewed was that the same physiotherapist was used. One issue with that is exhaustion. So that can result in a group threat or a single group threat, sorry. If we're looking at a single group threat, the maturation issue. So what's the problem with tired or bored? Experiencing the same type of treatment and routine treatment, which is outside of like the feel sense for massage therapists. And they typically want to feel the tissue and provide a different type of treatment based on their feel, that intuition or getting a sense of what you're touching. And the other threat to it is internal validity. So within the internal validity issue, we're trying to find a cause and effect relationship. And you affect that relationship by having a single tester. And once they're starting to experience the exhaustion, that affects your internal validity. Now, here we would want to see a number of people utilized, but there's also an issue with the type of therapists that are utilized. And what is it? So one of the things that we noticed, aside from just the type of therapist, was the stroke that was used in this massage treatment. So inside of this, I do need to go over the massage treatment itself, because one is it's called J stroke, very uncommon in massage, as well as highly uncommon in sports massage treatments for DOMS. This stroke was used during the Royal Morales study. And I'm going to go ahead and click the video so you can actually get an indication of what this stroke looked like. And then I'm going to probably cut it in about 1 minute just because of my time.
The more forceful soft tissue mobilization technique performed to release skin restrictions or adhesions that do not respond to skin rolling. While it can be used to increase mobility anywhere in the body, it should only be applied in specific areas and should not be used as an overall skin release. The patient should be positioned to allow maximum slack in the target area. To perform the stroke, use the finger pads to pull in all directions to evaluate skin mobility. When a restriction is felt, pull away from the restriction and leading with the motion lift the hook of the letter J. Repeat the J stroke until the restriction is completely released. Note that the client may report a burning sensation in the area. Performing the J stroke over a trigger point may cause a muscle spasm and get released. A block may be applied by the therapist's opposite hand to further increase the effectiveness of the J stroke.
Okay, I'm going to stop it right there, and then we're going to go back to the study. So when we look at that stroke in itself, as you can see, if you're athletic, you're probably thinking about, you've never really received something like that. If you're new to actually experiencing DOMS and then you receive a massage session, that DOMS, that treatment itself is not useful for DOMS. It's too light of a stroke, and then there's a certain type of mechanoreceptors underneath the tissue that you're trying to stimulate. So when you're thinking about having, let's say DOMS after 24 to 48 hours, even up to 72 hours post-exercise, that J stroke is probably going to be the last type of stroke utilized for your session. That's why that's another nuance in the literature. And it's commonly used to time an event in studies. Okay, so another issue with the Royal Morales study was, did they identify that massage enhance IgA secretion? And they looked at the stimulation for the autonomic nervous system, which, yes, it did produce a greater production, or sorry, a decrease in immunoglobulin cell, IgA. And when you look at the intense amount of exercise, they compared it to a sham, which the sham itself was not a massage type treatment. It was an electrotherapy treatment. And when you think about how these studies are read, they're not realizing, even though the data provides you critical information, what was used inside of the study. And when you compare a sham treatment like an electrotherapy to a massage, those do not meet up. There's no real comparison in that. They're two different type of treatments. So when you look at the population that frequently experiences DOMS, it's bodybuilders. That right there is a pro bodybuilder, which I myself actually do throughout his career. And when you look at me utilizing a J stroke for a bodybuilder of that size, it's not conducive to treatment, and that's not effective for treatment for them. This is another study that looked at the efficacy of muscle soreness or perceived recovery for bodybuilders. So I wanted to touch bases on the wide group. So I'm going to bring you into the bodybuilding realm about how much tissue trauma they occur from training and whatnot. So in this study, they looked at a different time length was measured. They looked at this type of treatment that really does not apply to the bodybuilding setting for massage. They used time strokes. So time strokes of 4 minutes for petrissage, effleurage, chipotle, Pac-Man, and the time strokes were at 4 minutes within that 30-minute bout. And then after the buzzer went off, the massage therapist was informed to switch to the stroke. So that's more of a control over the therapist, which is not realistic in a clinical setting either. So I really do give this study a thumbs down in the sense of what the treatment or the method was used during that time frame, because it doesn't apply to the clinical setting. So that's another caveat for seeing the nuances in the literature with how some of these studies, even though they provide valid information. The physiological information was beneficial. So creatine kinase or crereactin kinase, they're usually described differently, as I always say. So when you look at how the levels did drop, that's another way to identify inflammatory markers in the tissue. They dropped significantly, as well as I think interleukin-6 was measured on this one. I want to say interleukin-6, which is another inflammatory marker and anti-inflammatory marker. If not, I'll just have to go back and reread if this was an interleukin-6, but I do know it's a C-reactive or creatine kinase measurement for this one. So that study, that's just two different caveats I want to touch on that one. Here, which we look at future relationships to the effects of massage and DOMS. So more research is always needed, but the research focus that I would like to entice others to do as well, and myself included, is the effects of somatosensory responses. So sensory neurons. And forgive me, I did just get braces put on, so that's why it's a little... So when you look at the effects of deep tissue massage, there are sensory neurons that can be measured, which also have to do with your proprioceptors, nociceptors, as well. I think we talked about mechanoreceptors, even things like Purkinje fibers that accept vibration. Those assess or decrease the amount of stress response during the somatosensory response or the nervous system. The autonomic response, the ANS, is what we're trying to measure. So when you look at active release techniques, that also affects the sensory neurons via specific treatments for fascia restrictions or ligament restrictions of the tissue. There's about 500 protocols to active release technique, which are very specific to areas of the musculotendinous junction get restricted. Fascial stress therapy is another one that has to do with somatosensory responses because it's lateral lines, superficial back lines, entire lines of meridians or lines of, not meridians, sorry, lines that are being stretched. And that also gives you a sensory neuron stimulus to change and measure. Deep tissue massage, I want to say, is rarely implemented because a lot of the strokes are lighter. They're not necessarily deep tissue. And yes, there's going to be a higher inflammatory response from deep tissue massage, but the inflammatory response is actually a good thing because you have to cause tissue trauma to encourage healing. You want to stimulate osteoblast type cells or osteocyte proliferation. You want to stimulate red blood cells to heal tissue from the bone marrow, so you do need to penetrate a deeper depth. This is where foam rolling and stuff like that is a little bit confused because it's more superficial fascia, not deep tissue fascia. And there's different layers of those sensory neurons when you look at how they're layered. But again, that's a different talk. So I do also want to look at the relationship between deep tissue massage and anti-inflammatory foods to see if there's a superior effect from just massage alone and collaborative effect, which collaborative treatment, I believe by now, should be the goal for most people experiencing delayed onset muscle soreness. Now, is massage still recommended for DOMS? Now, one advantage of the massage is the reduction of muscle soreness. Now, it doesn't decrease performance, so I would say still to utilize massage posts for your athlete or general population, regardless of the type of athlete. So, and it's uncommon for an athlete to experience severe problems due to the lack of, it is uncommon for the athlete to experience severe problems due to the lack of required recovery intervention. So if an athlete does not have a recovery intervention or a, let's say, cumulative injury cycle that is intertwined with their training, and that has to do with the recovery treatment, then there is going to be tissue breakdown because there's going to be tissue trauma that occurs. If the tissue is not treated properly with a specific intervention, aside from your prehab interventions like foam rolling, dynamic stretching, then there is going to be severe injuries, but they just have to be addressed early on. And this is an area that I really like to look into is when does the tissue start to break down and when should we intervene with a specific type of treatment. So therefore, it's recommended to learn about the type of treatments provided during a sports massage session. Some of those treatments range from depth of pressure that's provided for your service or for that by the provider for a specific service. There's also the type of treatments used in conjunction. So active release technique, Grafton, or cupping. Those are the varying type of things that are used in some sports massage sessions, which, those are things that not massage alone is going to prevent DOMS. But if a treatment is used in conjunction with that type of like Grafton, cupping, or even laser or dry needling, those are the things you're going to see a severe or a change in it. What else do I have on there? Oh. Okay, and that looks like it's it. Hopefully I covered enough topics to give you an introduction to some of the stuff in the literature and the direction I'd like to head, as well as the nuances in the literature. All right, thanks. Close this one.